She is actually a doctor, all right, a palliative care doctor of Hospis, Malaysia, who has already completed her medical training in United Kingdom. She also actively involved in clinical work, education, and research, having recently presented her research findings on the perception of palliative care patients living in an urban area in Malaysia on advanced care planning at the 7th Conference of the International Society of Advanced Care Planning at Rotterdam last year. Today, the topic that she is going to share with us is what are the needs of elderly people in Malaysia? So, ladies and gentlemen, let us welcome Dr. Lin Zini.
So I'm going to start sharing my slide. Good evening, everyone. Thank you for inviting me to speak in this aging forum. The topic of my presentation this evening is on what are the needs of our elderly population in Malaysia, the role of palliative care. So we know that Malaysia is experiencing a demographic shift with 7% of our population aged 60 and above in the year 2020, and this is going to double in 10 years' time. And with improvement in living condition, better diet, and advancement in healthcare, this means that life expectancy increases. But as we live longer, many of the older adults will live with one or more health conditions. This will eventually lead to complex healthcare needs, perhaps poorer quality of life, as well as increased mortality. Older adults suffer unnecessarily, and their healthcare needs may be underassessed and undertreated. We know that the number of people with chronic non-communicable diseases in Malaysia is increasing. Is our healthcare system in Malaysia able to meet the needs of these people? So let me introduce you to Mr. A. He's a 70-year-old gentleman with a newly diagnosed lung cancer. He's been suffering from diabetes for many years and developed kidney failure as a result of the complication of diabetes, for which he has been undergoing dialysis for the past 3 years. He used to be someone who is independent, active, but for the past 1 year, he's mostly homebound, getting weaker, getting more tired. Living with chronic illnesses is not easy. Just put yourself in the shoes of Mr. A. What may be some of the questions that will go through his mind? What is happening to me? Can I be cured? What are my treatment options? What's going to happen to my family? Will I be a burden to my family? Who is going to look after me? Do I have the financial means to look for someone to care for me? Do I have a say towards making decisions? Am I going to die? And for Mr. A's family, some of the questions that may go through their minds would include, should Mr. A know about his illness? What if he deteriorates further by knowing about his sickness? What are his treatment options? What's going to happen in the future? Who in the family is going to look after him? And what will happen if there is minimal recovery? And there are many more questions that I'm sure Mr. A and his family would go through over the journey of his illness. So I'm just going to step away from Mr. A for a while and share with you a few slides on facts and figures. So we know that universal health coverage means that everyone have access to health care when and where they need without financial hardship. And this includes full range of essential health services from health promotion, prevention, treatment, rehabilitation, and palliative care. So ask yourself this question. Can we ensure that older adults in Malaysia receive palliative care when and where they need them? 2 months ago, in a recent dialogue by Dr. Tedros with the civil society organization for which Hospis Malaysia was one of the participants, key issues in palliative care were discussed, including palliative care for older people. Dr. Tedros highlighted that the COVID-19 pandemic is a reminder that palliative care must be available across disease and age groups through an integrated approach based on universal health coverage through primary health care. Older persons living in institutions, in intensive care units, and other persons with life-threatening conditions can require palliative care. And healthcare professionals and institutions must be prepared to relieve suffering, to ensure respect for patients' dignity and quality of life. But we also know that with this pandemic, there has been disparity in terms of access to healthcare because we are trying to shield older people at home. So where would they go to if they're sick, if there's fear of getting COVID virus in hospital? And if the older person is living at home and if they need palliative care or other medical care, who is going to attend to them at home? Do we have such services in Malaysia to cater to their needs? In the year 2014, World Health Assembly called upon World Health Organization and all member states, including Malaysia, to improve access to palliative care as a core component of health systems, with emphasis on primary health care and community, as well as home-based care. And Malaysia is a signatory to this resolution. So this figure basically shows you the projection of palliative care needs in Malaysia in year 2004, 2014, and 2030. And as you can see, in 2030, there will be a projection of about 239,000 people who will need palliative care, with the highest needs amongst those age group more than 80 years and above. So I'm just going to spend the next couple of minutes just explaining to you what palliative care is. Palliative care is really an approach to improve a person's quality of life. It's a holistic care where it is patient-centered. It takes into consideration the person's physical, psychosocial, and spiritual well-being. It provides a support to the family members who are the key caregivers for the person living with a life-threatening illness. Palliative care can prevent and reduce unnecessary suffering. It can be provided in any settings, be it at home, in the hospital, or in a nursing home. It can benefit healthcare system by reducing unnecessary hospital admissions. Palliative care is fundamental to health and human dignity, and palliative care is a basic human right. So let's come back to Mr. A, whom we talked about earlier, a 70-year-old gentleman with multiple comorbidities with a newly diagnosed lung cancer. I think as a healthcare professional, it is sometimes a difficult balancing act where you have to understand Mr. A's values, beliefs, system, and preferences, and weighing that against what healthcare can do versus the family's needs and priorities. And at times, there may be mismatch between what Mr. A wants and what family wants versus what the doctor or nurses think might be the best care for Mr. A. So the next couple of minutes, I'll just discuss with you with regards to what role does palliative care play in Mr. A's journey. So as I highlighted earlier, palliative care is about the patient, it's about his needs, it's about what he wants. Hence, the medical care that is provided is in line with what Mr. A wants, not what I want, not what the family wants. But it's also an opportunity to discuss, to have family, to have open communication and, including the family to facilitate decision-making process when there are conflicts, to discuss about goals of care. How much treatment does Mr. A want? And how much of those treatment is acceptable according to his needs? Palliative care also helps to coordinate care. We know that it is difficult, when a patient is sick to be going to hospital for treatment, coming back home with the stress of family having to, deal with new changes, to deal with symptom management, to deal with the emotional turmoil that sometimes can occur as a result of living with a life-threatening illness. Palliative care focuses on symptom management. For example, pain control. Palliative care provides emotional support to the patient as well as family members. And it also helps to address spiritual and social needs. In the last few months, weeks, or days of life, palliative care can provide that support in the place that Mr. A chooses, being at home, in the nursing home, or in the hospital. And last but not least, palliative care provides the support to the caregivers. Caregivers are really, the core in providing care for a person like Mr. A who wants to be at home. And one of the support that we can also provide is a bereavement support after Mr. A has passed on. So in conclusion, palliative care is an important public health issue due to population aging. It should be an essential component of healthcare. And I think there should be an early integration of palliative care into any model of care for the elderly in order for our elderly population to receive high quality care that ensures preservation of their dignity and their autonomy, to ensure that they receive care in line with their preferences. So I've come to the end of my presentation. Thank you for listening. If you have any questions after this forum, you can email me at this email address. And should you wish to learn more about what palliative care is, do visit our Hospice Malaysia website.